From the age of 40, your body often changes gradually and unnoticed, but it does change. And today, I'll show you which blood values you should check regularly to detect deficiencies, silent inflammations, or hormonal imbalances early. The standard blood test, meaning the standard blood test from your general practitioner, is not even close to being enough for this. It only shows you half the truth and far too little. If you really want to know how your health is and whether you'll still be as fit in 15 or 20 years as you are now, then stay tuned. I'll show you the 7 most important blood values you should have checked once a year. First, the thyroid, the metabolic switch, and the following blood values are important here. Thyroid stimulating hormone FT3, FT4, and if necessary also thyroid stimulating hormone thyroid peroxidase antibodies. Your doctor will know about this. And these values show you whether your thyroid is working in harmony or if it's out of rhythm. And especially women over 40 often slip unnoticed into an underactive thyroid or develop Hashimoto's. That's the autoimmune reaction against your own thyroid. Symptoms like fatigue, weight gain, or mood swings are often mistaken for menopause or stress, and that's wrong. So have these blood values checked. High sensitivity C-reactive protein can detect silent inflammations, and this C-reactive protein is your early warning system for inflammations. A slightly elevated value doesn't mean that you're sick, but maybe already a bit predisposed. Due to gut problems, areas of inflammation in the body, or even slow developing infections, and that can change your immune system in the long run. It can endanger your brain and your blood vessels. That's why the C-reactive protein value should be part of every annual checkup. 3. Have your sugar metabolism checked before diabetes strikes. Fasting blood sugar alone is not enough. You definitely need the hemoglobin A1C value. That's your long-term blood sugar value. You can also have your insulin level or even the homeostatic model assessment index measured to see how your insulin level and insulin sensitivity are. Many people develop insulin resistance over the years and only notice it when diabetes is already there. And it can be detected and even stopped so early, namely through the right diet, exercise, and the right habits. Now let's continue with blood lipids. This is an often underestimated risk, but total cholesterol alone is not meaningful at all. That's why you need to have everything checked. Specifically, total cholesterol, low-density lipoprotein cholesterol, high-density lipoprotein cholesterol, and triglycerides, the neutral fats. And that's crucial because it's not the total value, but the ratio that matters. A high-low density lipoprotein or a low-high density lipoprotein can indicate the beginning of vascular calcification, even if you feel fit. And yes, even slim people can have dangerous blood lipids. So measure, don't guess. 5th, ferritin. That's the storage value for iron, for your energy. It's the indicator of your iron storage capacity. And no, this isn't just a women's issue. Men can also have iron deficiency. For example, with chronic inflammation or intestinal issues. A low ferritin level can lead to fatigue, poor concentration, hair loss, and depressive moods. Anyone who follows a purely plant-based diet should pay special attention to this value. With a diet rich in vitamin C, you can actually absorb plant-based iron much better. Now for the 6th value, vitamin D3. The immune and strength booster, the vitamin D level is often too low, even in summer. And a good level is important for your bones, your muscles, your mood, your immune system, actually for everything. And no, 15 minutes of sun is often not enough in our latitudes, especially not from September onwards. A good target value for vitamin D should be between 50 and 60 nanograms per milliliter. You often only achieve that with targeted supplementation. And now comes the 7th value, homocysteine. Homocysteine is a silent vessel, and it is a dangerous risk factor for stroke, for heart attack, but also for dementia. Nevertheless, it is almost never measured as a standard, and yet an elevated level can easily be lowered with B vitamins. specifically B6, B12, and folic acid. This value is especially important for people with a particular genetic variant or for those following a vegetarian diet. But honestly, I've had so many people in my practice who ate a normal diet. They also had a high homocysteine level, and that's not necessary and shouldn't be the case. Because if you want to prevent problems, in my opinion, this value is essential. My conclusion: these 7 blood values show you where you really stand. They help you identify risks early and take targeted action against them. Important, it's best to have these values checked annually. That's the only way you'll notice changes and can react early. It's best to discuss this with your primary care physician. Some values aren't covered by insurance, but in my opinion, they're worth every cent. Because if you get sick, it usually becomes really expensive both physically and emotionally. And this way, you can truly live up to your full potential when you give your body the knowledge it deserves. Because clarity in your blood is the best foundation for real health. You probably know a lot of people over 40 who may have never heard of these values, but who would also like to make sure that when they're 60, 70, or 80, they're just as fit as they are now. So clearly you should share this video with as many people as possible right away because they'll be happy about it, and thank you.